Movement disorders really is one of the last fields in medicine that is apprenticeship based. So it really is a lot of hands-on learning and learning to hands-on learning and learning to easily identify different types of movement disorders. And that pattern recognition takes a lot of time and a lot of practice. And I think that is something, given the limitations of our training programs, that's very difficult to achieve when you're in that kind of squeezed for time space, to be able to see enough patients, to have hands-on experience with patients and having the expert guiding you through that learning experience. So one of the things I learned from a foreign national that I was training with in the past was that, look, we have this book where I live, but we don't have anybody to really explain what these words mean when I see a patient. So I think that's one of the biggest gaps. The best way, I think, to try to solve that is to give trainees more time in the clinic, but there are other ways to build out that pattern recognition that doesn't require the in-office time the way that we're struggling with now. I think the most useful thing is, do a 1-year fellowship, do a 2-year fellowship, get your hands in it and see a lot of patients. But we've done a lot of work in the virtual space to bring excellent education to you in off hours, videos of patients and things of that nature that helps people bridge that gap. But there's nothing like taking care of patients for learning.